Good morning everyone. Welcome to the Wellness Health Services Health Talk. We are continuing our reflections on the kidney diseases, especially at this time that the world is celebrating the World Kidney Day. It is important that we reflect on some of the conditions that affect the kidney, what are their main causes, and also we ask ourselves, how can we prevent these conditions so that we have fewer people getting affected by kidney problems. So our topic of discussion today will be reflecting on nephrotic syndrome. Nephrotic syndrome, as the name says, syndrome means a collection of signs and symptoms which result from kidney damage, and the main characteristic is one is proteinuria. Proteinuria means loss of proteins in urine. There is a hyperlipidemia, which is an excess of cholesterol in the blood. There is decreased albumin in the blood. This is as a result of the excess loss of proteins in the urine, and as a result of this, low albumin in the blood leads to low to fluid overload. So the signs and symptoms of this disease, there is an excess of fluid loss, and there is also fluid overload, which presents with leg swelling. You can have generalized body swelling. You can have abdominal swelling with what we call ascites, which is an accumulation of fluid in the abdominal cavity. You can have facial swelling. There is increased risk of hypercoagulability, such that these individuals, they are at higher risk of getting venous clots, and there is also an increase in the cholesterol levels of the blood, what we call the lipids, when you do blood tests. And as a result of the fluid overload, and this leads to increased chances of infections, because fluid forms a good culture media for bacteria and other organisms to multiply. So what are the main causes of this nephrotic syndrome? Some of the factors could be primary to the kidneys, like various injuries to the nephrons, which is the main fluid regulating and electrolyte regulating organ in the kidneys, the nephrons, and they become affected by various immune mechanisms, which leads them to more permeable to albumin, and this leads to loss of albumin in the urine. You can also have secondary causes of nephrotic syndrome, conditions like HIV, obesity, some drugs like the excessive use of NSAIDs, like drugs like brufen, diclofenac. There is genetic aspect of it, some malignancies, and then infections like hepatitis B and C, and then diabetes. Then you have also other metabolic conditions like amyloidosis, where you have excessive deposition of abnormal amyloid in the kidneys, leading to increased permeability of the nephrons. Any person of any age can be affected, but it is common in males and females. The main diagnosis of nephrotic syndrome is finding proteinuria in urine. There is a test that is done where you do the urine dipstick. You find that there is an increase in the proteins in the urine. Then you can follow this by doing a 24-hour urine protein. Another test that you can do is doing the liver functions, and you can do the serum albumin levels. And because of the excessive loss of albumin in the urine, you have a decrease in the serum albumin. Then when you do the lipid profile, you find there is an increase in the lipid levels. Then you can also do immune markers, especially if you are thinking that the cause of the nephrotic syndrome is due to an immunological condition, especially conditions like lupus. And finally, the gold standard would be to do a kidney biopsy, whereby you take some kidney tissues and you take it to the lab for analysis, and you can be able to diagnose various conditions that affect the kidney tissue. Treatment, there's the definitive management, and there is also the supportive. On the supportive side is trying to get the excess fluid from the body using drugs that help to remove excess water in the body, like diuretics. The drugs like furosemide can be of help. Then also fluid restrictions, how much fluid you take per 24 hours, where you try to lessen the amount of fluid you take to less than 2 liters in 24 hours. A decrease in the salt intake. This will, because salt itself, the sodium in salt, helps to retain water. And so if you take excess salt, especially the one that we had at the table, then you have an excess of salt, and this will encourage more fluid retention. There is an aspect of diet whereby you try to regulate the amount of proteins. You take adequate amount of proteins without an excess, so that you also don't increase the amount of proteins in your body. And then there's also control of the other conditions like diabetes, HIV, use of ARVs, so that we prevent HIV-related nephropathy. Optimal control of blood sugar, so that we try to delay the progression to diabetic nephropathy. And then also, when you have the conditions that affect the kidney themselves, the glomerulonephropathies, then use of steroids. And these can be used up to 1 year, so that we try to prevent the immune mechanisms that are happening in the kidneys. And in severe cases, then you have use of drug modifying agents, which try to control the nephropathies, so that you don't progress to overt kidney failure. We have said these individuals, they are at increased risk of getting hyperlipidemia. Statins have a role, and these are drugs that are used to help to lower the lipid levels in the blood, so that the increase in the lipids lead to what we call atherosclerosis, which is a progressive condition where there is narrowing of the blood vessels, and this can lead to cardiovascular events like stroke, heart attacks, and of course peripheral loss of blood supply. Then, because of the increased risk of hypercoagulability, the risk of getting clots can be reduced by use of heparin, low molecular weight heparin. So in summary, we are saying that nephrotic syndrome is a collection of signs and symptoms resulting from kidney damage, and it is characterized by loss of proteins in urine. There is an increase in the lipids in the blood, there is a decrease in the albumin level in the blood, and there is the generalized fluid overload. It presents with the signs and symptoms of fluid overload, and affects individuals of all ages, and it can be caused by different conditions including diabetes, HIV, some drug use, and the infections like hepatitis and HIV. Prevention usually is controlling the underlying conditions, and also there are some behavioral and lifestyle changes that can prevent the progression of the disease. Thank you very much for listening to me, and I encourage you to subscribe to our Wellness Health Services Health Talks channel, so that you can benefit more from our talks. And as we celebrate the World Kidney Day, we encourage you that you take some actions which can give you better kidney health, changing your lifestyle, including decreased intake of salt, increased physical activity and exercises, and avoiding unnecessary use of drugs unless they have been prescribed, and also control of the main condition, lifestyle conditions like diabetes and HIV. Thank you very much.